Welcome everyone, Dr. Mandell here. There are millions of people who are suffering with TMJ involvement. This is where the mandible fits together to form a hinge-like jaw joint. Between the two bones is the articular disc. Although the TMJ is classified as a hinge joint, its action is much more complex. Now, many of you might be experiencing changing in your bite, pain in the jaw, difficulty chewing, pain radiating into the facial area, affecting your eyes, your nose and sinuses, your mouth. It can actually affect headaches as well as neck pain. The complexity of the joint not only moves the jaw up and down like this, but it moves side to side as well as in and out. So there's a lot of movement in that joint. And when there becomes inflammation in the area, that can really cause chronic problems. So the purpose of this video is to reset that joint. When there's lack of movement in a joint, there's lack of function. And when there's lack of function, there's usually inflammation, pain, and distress. So take these two fingers, put it on both sides of the cheeks, bite down, and you'll feel those muscles contract. Those are your masseter muscles. Take the fingers and just go in circular motions. You can spend a minute and a half, 30 seconds, whatever feels good, and just massage those muscles throughout the face. So let's palpate or feel the TMJ when we open and close our mouth. Take these two fingers, put it below your ear, open and close. You'll feel that joint open and close where it gets wider and narrower. So let's put movement into the jaw side to side. As we do that, we're going to break up fixations, areas that are not moving, and help restore mobility and function in that joint. Take your fingers, bring it about 2 inches below your ear. Relax the jaw and just go side to side. Just like this. You can come up a little more if you like towards the ear and just go side to side. About 25-30 seconds. So here is the key to this technique. Most therapists, clinicians, and doctors address the jaw open and closing like this. They address it going side to side that we just showed you, and they address it going forward. But very few people address it going backwards, posterior translation. So we're going to bring the jaw back into posterior translation, bringing it as far back as we can until it just stops. And then we're going to bring it back forward again, and then go back again. And we're going to do that about 5 or 6 times. And by doing that, we're going to refresh and reset that jaw area to allow that gliding mechanism that potentially was locking the whole time or interfering with all the other motions. Take your fingers of your hands, grab your lower chin on both sides. Relax the jaw. What I want you to do is just push straight back and hold it for about 3 seconds. And go back again. Push back again, 3 seconds. Good, come back. Push back. Come back. Back. Come back. And one more time. Good. You'll notice you feel pressure in the upper jaw, somewhere different than you felt before. That's a good thing. Forward head posture, being in this position, puts a significant amount of stress on the TMJ joint. Chin tucks, taking the chin and keeping your chin level with the ground and bringing your head straight back like this, like a double chin. 3 seconds, go back. Back. This way. 3 seconds, hold it, and come back. 10 to 12 repetitions, 2 to 3 sets every other day will make a big difference in healing your TMJ problem. Be aware that when you look down, jut the chin in like this rather than the head forward. A few important things to understand. Number one, it's always good to get evaluated by a doctor or therapist if you have chronic problems. Number two, if you're doing this technique and the pain is unbearable, don't do it. As you do this technique, you'll notice that your mobility may not be as good as others, so don't force it. As you continue to do this over time, the mobility will continue to get better, meaning part of healing. These conditions could be chronic, they could have been sitting around for years, but if you continue with this technique, particularly in posterior translation, I really feel that this will help many people out there. So share this video on your social media so we can help others worldwide. Leave your comments below because I know there'll be many. And most important, make it a great day. I'm Dr. Alan Mandell.